delirium. I had no idea it was a thing, and it really is a thing.
It's a very big thing, absolutely. The place we tend to pick it up is usually in hospital, but certainly not always the case. So I might be the first person to see someone with a delirium that's been missed, for example. The easiest way to describe delirium is if you've ever had a really bad flu. And it's so bad, you feel really out of it. You might have some strange experiences. You can't concentrate. Your thinking's all over the place. You feel feverish. Essentially, that is delirium. But what we know is that in older people, they're much more at risk of getting delirium. And when they do get it, it tends to be much more severe. And in fact, I think there's growing recognition that actually your risk of dying with delirium is significant. And part of that is because it is often missed in hospitals. So there's loads of work going on these days about raising the awareness of delirium when someone's an inpatient. I could talk for hours about this, but the commonest causes are things like having a water infection. So that really, really knocks older people around.
They're a nightmare, aren't they?
It can be really difficult and people will hallucinate. They'll start believing things that aren't true. Their concentration will be everywhere. And often behaviours will get really difficult. So people will be terrified because of the experiences they're having and they don't know what's going on with them. So waterwork infections, but it's other simple things that we forget about. Being constipated is a huge cause of delirium in older people. I would urge everyone to say, if you've got someone that seems more confused, just ask them if they opened their bowels recently. Because it's something as simple as that. And the consequences can be really very, very severe.
I think that's the trouble, isn't it? You think maybe urine infection, a few pills and it'll be fine.
Yeah.
Actually, it's terrifying and it's potentially fatal.
Potentially fatal. And the thing that I think people still haven't really appreciated is delirium can last for weeks, if not months. So I certainly see a lot of people that have come out of hospital and I'm kind of managing what we might call kind of chronic delirium. So it's going on for months and months. So sometimes it's thought if you treat the infection, the delirium will disappear immediately. Often, particularly if you've also got dementia, that is absolutely not the case. And those symptoms can really last for many, many weeks and months. So it's a really important topic.
You know how to diagnose it.
Yeah.
Again, for somebody like me with a relative, how do I help my GP to diagnose delirium?
I guess the big hallmark would be, has there been a sudden change? Because often what delirium gets confused with, and you can understand why, is dementia. Now, dementia, by and large, tends to come on quite gradually. There are exceptions to that, but by and large, it comes on over time. With delirium, that won't be the case. There will be a sudden change in how someone's behaving or thinking or speaking. And the trouble is, it can go two ways. So you can either have what we might call hyperactive delirium, where people become very disturbed, might hallucinate, do things that are very unusual, sometimes quite upsetting for people. Or you can have what's called hypoactive delirium, when actually people will suddenly just become much sleepier, not really engaging with anything. And that's much harder to spot, even for professionals. That quite often gets missed. And the classic example is someone on a ward where they're not causing any bother. So often their needs might get overlooked, but actually they've got a raging hypoactive delirium. So an acute change is the biggie. If people are having strange experiences, so if they're hallucinating, for example, commonly they might see things that aren't there. It could be insects or other people in the room, or sometimes auditory hallucinations, so hearing voices that aren't there. That's often another hallmark of delirium. And then the other biggie is a fluctuation of concentration or alertness, if you like. So people might drift in and out. So sometimes they might seem quite lucid, and then at other times in the day just seem really, really confused and out of it. If you've got those, you've pretty much diagnosed delirium, I would say.
And what's the treatment for delirium?
Well, again, no easy answer, but primarily the treatment is to treat the underlying cause. Yeah. So if you've got an infection, that will make you delirious. You need to treat that infection. But I think, unfortunately, some people think that that's where it ends. That won't be enough. So you have to provide loads of supportive treatment in delirium. So it's around people feeling safe, essentially. So constantly reorientating people. Lighting levels and that kind of stuff can make a big difference as well. So there's loads of kind of supportive treatments that if you're putting in place whilst you're treating the underlying cause can really affect how well the outcome is of that delirium. What we're trying to avoid these days is resorting to medications to treat delirium because they're dangerous, some of these medicines. So they tend to be reserved for if people are so behaviourally disturbed that they're putting themselves at risk and they need treatment to stop them doing risky things towards themselves or others. So it's treat the underlying cause, get it diagnosed first, and then kind of all these supportive measures to put in place as well, so people understand what's happening to them.
Definitely. Well, it feels like it's a bit of a sleeping giant, and we should all be paying more attention.
I think so. Yeah,
things like that.
There's a chance to really improve outcomes for people and costs actually. So if you get delirium in hospital, you stay longer, so you cost the health service more. You end up not going home, and you might end up even being placed in care because your delirium hasn't been treated properly. So it's hugely important. So huge thank you to Dr. Alex Bailey. You can hear a whole podcast about dementia, which we've made with him this afternoon as well. We also have lots more podcasts that can give you help with money matters, care, and some of the fun things like driving and holidays. So do look out for those. If you can rate and review us, it helps more people to find us. So please do that if you've enjoyed this podcast. Thanks for listening.